Ugh, fever again. You feel hot, uncomfortable, and just want to curl up and sleep? And as usual, you start reaching for some meds, maybe paracetamol or ibuprofen. But wait, before you swallow these little pills on your hand, have you ever stopped to ask, do I really need to bring my temperature down every time I get a fever? Well, first off, thumbs up for thinking about this. Do you really need to bring your temperature down every single time you get a fever, especially if it's just fever and no other severe symptoms? I mean, yeah, it's uncomfortable, but what if I tell you that fever isn't actually your enemy? To understand this, let's zoom in and take a quick peek at what's going on inside your body when you're burning up. See these guys? Bacteria, viruses, whatever's invading you, they're the ones causing trouble. Most of the time, your body stays around 37 degrees Celsius. But once it detects these invaders, it cranks up the heat like, all right, let's cook these germs. And guess who's controlling all this? It's a tiny part of your brain called the hypothalamus. It works like your body's thermostat. Once it decides to raise your body temp, your normal is no longer 37 degrees Celsius. Maybe now it's aiming for 38 degrees Celsius. So even if you're technically warm, your body feels cold. It tells your muscles to shiver and your blood vessels to tighten. That's why you get chills and stop sweating. Your body's just trying to heat itself up to reach the new goal. And your body is making the right choice. These viruses and bacteria can't survive in higher temps, so your body's basically roasting them alive. And at the same time, your white blood cells, your little internal army, actually work better in warmer conditions. They get more active, more aggressive, and ready to destroy anything suspicious. But then you might wonder, if fever is something my body creates to fight bacteria, why does it make me feel so weak and uncomfortable? Well, fever isn't just targeting the bacteria. It also signals your body to slow down, so you rest, save energy, and let your immune system do its job. Once the invaders are taken down, your body sends in the cleanup crew, macrophages, to gobble them up like little vacuum cleaners. These broken down bits then get flushed out so your body can fully recover. As things settle, that's when your fever usually starts to go down. For most people, it takes about 2 to 3 days, depending on how strong the infection is. So yeah, fever's not just random suffering. It's literally your body fighting back smarter and harder. But please be reminded that it does not mean to never take meds. If your fever hits 39 degrees Celsius or you feel awful, sure, get a med and bring it down a bit. But if it's mild and you're otherwise okay, maybe let your body do its thing. During this time, make sure to rest, stay hydrated, and stick to light meals, so your body can focus on fighting the infection and not use the energy to digest a heavy dinner. And of course, if you've had a fever for more than 3 days, or you've got serious symptoms like chest pain or trouble breathing, go see a doctor, okay? And that's all for today's video. So next time you've got a fever, maybe it's not just something to fight, it's your body fighting for you, like the hero you didn't know you had. Got any other medical myths or questions on your mind? Drop them in the comments, and who knows, it might just be the topic for the next video. Till then, take care, stay curious, and I'll see you in the next one.